touching me! Stop! Addie, you're bleeding.
I never even hit her.
She seems fine.
She is fine. She coughed up blood. Past tense.
She has diarrhea.
From the antibiotics for the infection.
Lung biopsy says she doesn't have an infection.
Well, and you screwed up the biopsy.
Well, you're wrong about infection.
Well, if I'm wrong, then so's her body, because it obviously thinks she's got an infection or it wouldn't have gotten better from the antibiotics. What is pandiculation symptomatic of?
Yawning's a symptom of fatigue or cholinergic excitation.
Does this have anything to do with Addie?
Let's say yes.
Cerebral tumor, epilepsy, could also be a medication reaction to antidepressants or some meds for end-stage liver failure.
Let's say no.
She can't breathe. Get off the bed.
Need a crash cart.
What's happening?
Let's get her down now.
Pressure's collapsing in her lungs. She's not getting any air.
Oh my God.
I was fine. Liver enzymes were normal.
There's something called blood in the pleural effusion. Oh, it's not blood, it's blood. Which is great. Not for her, but for me, because it means I think it's an infection.
Labs indicated minute traces of blood.
Can't ignore the blood because it's a minority. Can you, Foreman?
If we count the traces of blood as significant, the differential isn't just infection. It could be lung cancer, breast cancer, lymphoma.
Great. Go tell her she's got one of those. Or you could tell her that we haven't given her enough antibiotics for her infection. Double the dose. Check her lungs.
We checked her lungs. They're clean.
On the outside, she needs an arteriogram.
Arteriogram was normal.
Which means her lungs are fine.
What if the clear arteriogram is significant?
It is significant. It means there's no infection.
I think there's an infection.
Infections don't come and go. People don't get better than worse on the same treatment.
Unless her body can't finish out the fight. Maybe it goes a couple of rounds, then gives up.
I would have give up.
Maybe its name is Foreman. Come on. Where's that smile? That laugh that makes the whole world sunny without contributing to global warming. Maybe she's missing a protein.
Blood panel and enzymes show our proteins are normal.
You can't test it for every protein. I could think of at least one you can't test for at all.
Complement factor H deficiency. If she has that, she's dead. No way to fend off bacteria. She'll get one infection after another until her body shuts down.
Maybe we can get ahead of the game, manage each symptom as it comes up. Give her 5 miserable years instead of 6 miserable months.
There's no diagnostic test for complement factor H deficiency.
So we isolate the cells that are yummiest for it. Stick a needle in her eye.
Macular biopsy was negative, which means you're wrong. There's no complement factor H deficiency.
Most likely cause of altering blood flow in the brain is a clot or a tumor,
We can rule out a clotting issue because she has a bleeding issue.
which means we should be looking for a tumor.
I think there's an infection. Just because the cells in her eye aren't dead yet doesn't mean they're working.
So why did we do the test?
Because if it had been positive, it would have proved I was right.
But negative doesn't prove you wrong.
That's the beauty of the test.
She needs an MRI of her brain.
Absolutely. As long as you're scanning, do you mind having a boo for an abscess or something caused by an infection?
What's wrong, Addie?
My head hurts.
Brain's clean. No tumor and no abscess. All wrong.
My head. Ah! 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 My head.
It's much more likely she has an invisible protein that allowed bacteria to arbitrarily invade her lungs, then arbitrarily invade her pleura, then arbitrarily jump into her head.
If it's autoimmune, she can live. But we have to give her steroids now, before her heart ruptures.
If you're wrong and you give her steroids, she dies now. Foreman, you want to run down how it feels to go with your gut and kill a person? You can get into the whole spiraling out of control, self-doubt, resigning thing. Do it. worst that can happen is you quit. Cameron, you want to explain to the parents why you'll be holding paddles while he's doing it? So if her heart goes boom, it'll boom right away.
Chase was wrong. Addie's kidneys shut down.
I want to hear you say it, Chase. It will please me.
Doesn't mean you're right. You predicted cardiac arrest, instant cardiac arrest.
There were only two choices. Since yours was wrong, mine must have been right. Either that or we missed the leprechaun.
If you're right, there's nothing to be done. The steroid treatment we gave her means when the next infection hits, it'll hit hard. Liver failure, cardiac arrest.
But on the bright side, it confirms my diagnosis. Don't you see how incredible this call was? A protein deficiency. Can't be tested, can't be seen. I called it based on coughing blood.
You're happy about this.
She's going to die.
That's not my fault. She was gonna die anyway. And now, thanks to me, at least she'll know why.
I'm sure you'll see that gratitude in her eyes when you tell her.
How long?
2 days, maybe less. You have a condition called...
Doesn't matter.
It's a very rare protein deficiency that only manifests...
I don't want to hear it.
Okay. It's what's killing you. This is what's killing you. You're not interested in what's killing you?
Will it make any difference? Will I live any longer? Please, could you just leave?
What's the point of living without curiosity? Without craving the...
So, I'm screwing up my last few hours because I won't listen to you.
Get out of here.
This is like the dark matter in the universe.
You're smiling.
No, I'm not. You can only diagnose a problem by looking at what's missing. You have got leprechauns in ya. Depression manifests in lots of different ways. Some people can't get out of bed all day. Others have serial relationships and become oncologists.
I'm dying. I'm not depressed.
Wrong and wrong. You tried to kill yourself by throwing down kitchen cleanser. Now, most normal suicidal morons would have just drank the stuff, burned the hell out of their mouth and throat. Painful, but not deadly. But being a college-educated suicidal moron, you wrapped it in gel caps or gum, which left no trace, but burned a hole in your intestine. But the body can repair almost anything, which is cool. In your case, scar tissue closed up the hole, but it also formed a bridge between a vein and an artery. Veins are supposed to help the intestine flush bacteria away, but the bridge allowed the bacteria an entrance to the artery, where they got a free ride everywhere.
Can you fix me?
Surgery to fix the bridge take about 2 hours. Psychotherapy's gonna take a little longer. Why'd you do it?
I don't know. I've just never been happy. Please don't tell my parents. They'll blame themselves, and it's not their fault. Please, you can't tell them.
Technically, all you have to do is promise me that you won't do it again. And legally, I can't tell them.
I promise.
Yeah, sure.
This little camera
transmits images to the data recorder so we can see if you've got any vascular malformations in your GI tract. Your records show you've lost some weight over the past year. Was that intentional?
Not really.
Well, he's been eating less since he quit the swim team.
You have to get up early for swim. It wasn't fun anymore.
I need to talk to your son about sexual activity. Generally, it's less embarrassing for everyone.
We're leaving.
Actually, I've only ever...
How long have you been cutting yourself?
Those are from a layback grind that went wrong. Came off my skateboard straight into a fence.
So, no to cutting, but yes to appetite and sleep changes, and you quit something you used to enjoy. How long have you been depressed? No sign of upper GI issues, but the kid did admit to being depressed and to smoking pot to take the edge off.
You are very pleased with yourself, aren't you?
His marijuana could be laced with formaldehyde or lead, which could cause a pulmonary hemorrhage, which could make him spit up blood. Yes, I am. It was a good catch.
Run a lead level, push 5 liters IV fluid.
Feel free to tip your other server.
Well, you figured out my deal after only a few minutes. I've been fooling my friends and parents for months.
It's my job to notice things. Maybe talking to your parents would make things better.
I've tried. They take it personally that I'm not happy, and then I end up having to make them feel better. They don't get me. No one does.
In med school, it seemed like everybody else could handle the pressure. I couldn't. I ended up hurting myself. Stupidest thing I've ever done. You've got red spots in your eyes. They weren't there before. We still don't know why Ryan coughed blood, and now he's got small hemorrhages in his eyes.
Sounds like an acquired coagulopathy, which gives us a pretty wide differential.
Gets a lot narrower if we factor in his depression.
Oh, don't do that.
Mood swings could be a symptom of physiological illness.
I'm talking to you.
Mood swings are also a symptom of adolescence, along with emo music and masturbation. More importantly, his weight loss and sleeping issues started a year ago.
Infection makes the most sense. He shoot soups at school, showers in the locker room. I'm thinking staff.
Damn.
You don't think...
Not talking to you.
Everything okay with Cuddy?
She's fine. She's just too stupid to accept it. Start him on nafcillin for staph.
I told you, man, I don't have it here.
Hey, guys. Everything okay?
On my way out. I'll see you later.
You wanna tell me what's going on?
My friend gave me some leftover Klonopin he had when he switched to seizure meds. I sold him to Roid Rage for $80, but I landed in here before I could deliver, and now he's gonna rip my arms off.
How often do you sell drugs?
It was a one-time thing. I needed the cash, I had the pills, so I thought, why not? That was a bad idea. The pills are at my house. I gotta have a friend go get them.
Give the thug his money back. One time only.
Good for you. You could have just assumed he was a drug dealer, but instead you took his word for it. It's nice to finally see someone have a little faith in humanity around here.
Why would you do that? Ryan, you okay in there?
I'm not sure. I think I just peed blood.
Looks like peeing blood is the new black.
Peeing blood after a night on antibiotics means we can move on from infections.
Hoping you showed no sign of a bleed in his bladder, which points to a kidney problem.
Probably some kind of mass.
Kidney mass wouldn't explain the coughing blood or the hemorrhages. Antiphospholipid syndrome, on the other hand.
Makes sense. That doesn't rule out a mass.
You think it's cancer?
Mass doesn't have to be cancer. It could be renal hematoma.
But the patient doesn't have any other abdominal trauma.
He's not talking about the patient.
Cuddy has a mass on her kidney?
Probably just a complex cyst or angiomyolipoma.
It's a mass, not a mystery. They'll do the biopsy, then you'll have your answer. Just have to wait.
Patient admitted to using pot. Who knows what else he's doing? This could be heroin-induced nephropathy.
I thought you trusted this kid.
And then you pointed out how sweet that was.
If it were heroin, he'd be going through withdrawal. Antiphospholipid syndrome's a better fit. Start the patient on plasmapheresis.
While he's doing that, can I at least search his house for drugs?
I ever said no to that question?
What is it with you and this kid?
He's doggy paddling in the sea of misery. I remember what it's like.
How far do you have to reach back for that memory? Last night? Sometimes I hear you in the living room watching TV at 3 a.m.
That's when classic Doctor Who comes on the BBC.
Yeah, if only they had some device that allowed you to record them, watch them another time. I'm just saying, don't think fixing this kid is gonna fix you. Yep. On our way back, a patient lost all feeling in his right arm.
Look at this.
What's up, losers? I hope you're enjoying being alive. Today's lesson, natural selection. Excellent system made us who we are today, but then we invented seatbelts in grocery stores. Things that keep idiots and weaklings alive. And let's be honest, most of you don't really deserve it. Here's to the natural order. Yes!
Copied from his flash drive. Do I go to the cops?
Yes, officer, I'd like to report an assault. The victim was a pile of leaves.
It goes on. He talks about bombing his school.
Which you know because you stole his flash drive and broke into his house. How's that gonna play?
Ryan's not responding to streptokinase. We don't know very long before the damage becomes irreversible.
So we either up his dosage or go into his head and get the clot out.
We'll run a corkscrew-shaped instrument into Ryan's brain and pull the clot out.
Okay. Have you talked to him about it?
Yes, but I wanted to see you alone. I saw some videos that Ryan made a few weeks ago. He's blowing up pipe bombs and threatening people in his school.
Oh, God.
He was probably just messing around. Our son wouldn't hurt anybody.
I'm not so sure.
Look, I know this looks bad, but Ryan's a good kid. He's had a rough couple years since he started high school, but I really think he'll come out of it.
He needs help.
Maybe he does, but this gets out, he'll be suspended, maybe expelled. How about you focus on keeping him alive?
Give me a little more dye.
There's the clot. It just disintegrated when you touched it.
Take him off the meds. He's got a staph infection.
You treated him for staph 3 days ago. It didn't work.
Bacteria already in his system responded. But once the door's been busted open, more just keep coming.
Oh, he's talking about an abscess.
I got that.
For the cheap seats, an abscess is a gooey little cream puff of infection. Probably burst when your little pride and homicidal joy took a hard foul.
It's good news.
If we can find the door.
I think I know where it is. What if these aren't from skateboarding? The kid has been blowing up PVC pipe bombs. If he got hit by shrapnel, the body walls off the foreign object, which, because it's plastic, doesn't show up on imaging and provides a perfect home for bacteria. Antibiotics attacked the infection, causing feces to break off. Some hit the liver, one lodged in his brain and dissolved when Foreman touched it. Once we drain the abscess and remove the shrapnel, the antibiotics can do their job. He'll be fine.
Which just leaves, what are you gonna do now?
Guess what kind of animal Wacky Benny's making now?
I'll give you a big hint.
Is it a dead animal?
I say we put him out of his misery and bring out Emma's cake.
He's so new to this. How's he gonna learn if we stop his act?
You're a sucky clown.
And you're a super duper audience. Hey, that is not okay. Hey, keep your hands off my son. Tell him to keep his hands off of me. I can't move my arm away.
Maybe we find you a new hobby, one you're a little better at.
I'm gonna get better at it, and it's not a hobby. I think I want to get a job working as a circus clown, making people laugh.
Man, I don't think that's a good idea.
It's good enough for my dad. You were
Oh, his biological father.
Could his dad's melanoma be a factor here?
That wouldn't be related.
Ben, you barely knew him. You're such a smart kid. You could aim a lot higher than face paint and seltzer bottles.
Dr. Park is searching the registry. Transfusing his platelets will keep him healthy while we wait.
You sure there's no one on the father's side of the family? If one of them's a match, that'd speed things up a lot.
His parents died young. He was an only child. There's no living relatives that I know of.
Something will turn up soon.
How soon is soon? Will he miss a lot of school?
I'm actually thinking of just getting my GED.
How do you expect to get into a good college?
I'm gonna take classes on magic, juggling, try to make a go of this.
Ben, you keep your grades up, you can do anything in the world.
Like what? Work in some boring office? I mean, do you think my father would have done that for 10 minutes?
You don't remember your father. You don't know.
I want to build a connection with him. Pass on some of the joy that he gave me. My back hurts.
BP's dropping. You had to stop the transfusion. Patient's having an allergic reaction to donor platelets.
No one in Mom's family's a match, and as far as she knows, Dad has no living relatives. It's been years since he died.
The kid's dad died young of melanoma. How come the overprotective mom never took him to a dermatologist?
He never had melanoma.
How did he die?
He didn't. He lives in Pennsauken. Under a different name. Mitchell Gordon.
How could you keep this from me? From Ben?
He really needs to know his dad just breezed in and out of his life drunk and incoherent. It's better to think the man's dead but decent.
Mitchell Gordon?
I've already got a religion. Go away.
We're doctors. Your son, Ben, is in the hospital, Princeton Plainsboro. He's very sick.
Yeah, well, I don't have a son. Not anymore.
We know there are some issues there, but your bone marrow could cure him.
There's a hospital 2 miles from here. It's a simple test.
You said he was at Princeton Plainsboro.
His mother feels it's better to do the test at a different hospital.
Like I said, I don't have a son anymore.
You have to go see him yourself. He wouldn't even come to the door a second time.
Okay, I'll drive over there.
It's a pleural effusion.
He had a bleeding problem earlier, must be bleeding into his lungs. Except there's no blood. What does that mean? It means you don't have to make that drive. The problem isn't his marrow.
I can't believe I have cancer.
We caught it early. You should be okay.
I could die. I never went anywhere, did anything. If my father had lived, everything would have been different.
Your mom and stepdad love you. They've given you a great home. That counts for a lot.
He's crashing. Everything's shutting down.
House.
Hello?
What the hell are you doing here?
I was told this might be my last chance to see my son.
You had no right. This is none of your business.
I didn't.
I called him. This man's Ben's hero. Let him spend 5 minutes together.
No, get out of here.
Wait. You sexually molested your son. Your walk, TV's Drastic. You have late-stage syphilis, which you gave to our patient, presumably 12 years ago, which also explains why Mom is not big on family reunions.
I shouldn't be here.
We tested him for syphilis. He was negative.
After 12 years, the active infection would have died down everywhere except the arteries in his brain where it could hide out from our tests. When that 6-year-old heckler punched him in his juggling pins, kicked up the dormant bacteria in his pelvis. The immunosuppressants we gave him sent it into overdrive. The antibiotics we gave him actually started destroying the syphilis. But like pouring water on a fire, it led to a trail of toxic smoke and ash. Made his immune system overcompensate. A severe Jarisch-Herxheimer reaction.
Is this true?
Yes, Jarisch-Herxheimer is real. It sounds silly, but... Oh, you mean the right.
I found stains on his clothes. He didn't understand. And he didn't seem traumatized. I kept trying to talk to him, but before long he'd forgotten, and he seemed happy and he seemed normal.
So you made Daddy go away and you made sure Junior had no reason to go looking.
I was just trying to protect him. Like I should have done from the start.
Penicillin and anti-TNF antibodies will be fine. Apart from the whole daddy rape thing.
We're not done.
No, we are not. Notify the dad's sexual partners, notify his employer, his landlord, notify the police.
I meant the kid. We're not gonna tell him he was molested?
To make him miserable or to forfeit your license?
To tell him the truth. He's a virgin. How do we explain the STD? It's a medical diagnosis. Screw the parents. The kid's our patient.
I guess Taub's got a tough choice to make when the kid wakes up.
Why is it my choice?
Because you're a dad. How could the rest of us possibly understand?
What was wrong with me?
It's called syphilis.
You can get that without having sex?
I didn't tell him.
Your heart said he needed to know. Your brain knew he's better off without it. Following your heart is easy. Following your brain is tough. Especially after years of following that much smaller third organ. That's why all parents screw up all children.
Got a case for you.
Smells funny.
Patient had an idiopathic anaphylactic reaction. Stumped 2 ER docs and an immunologist from Johns Hopkins.
Patient went from asymptomatic to fried kidneys in less than a year. Stumped 3 internists and a department chair from Harvard.
14-year-old girl, intermittent attacks.
4-year-old boy, consistently at death's door.
This patient died 5 years ago.
I didn't say which side of the door he was on. The fact that he's dead makes it more interesting. 4-year-olds do not die of burgers.
I thought it was relevant.
Death is a consequence, not a symptom. And if it's not a symptom, it's not relevant.
Shouldn't we be trying to maximize what we can save here? 14-year-old, your freedom, our asses.
Right. Save your asses.
She was in a car accident when she was 2. She only had minor injuries, but her father died.
That was 12 years ago. You think that's pertinent?
No, I think it's sad. She got sick in the middle of her 14th birthday party. Which is sad and pertinent. Maybe she was opening a present that triggered the reaction.
Whose house?
Pissing contest with Foreman.
Last thing she ate was strawberry cake, but allergy tests for everything were negative.
You like your dentist? I'm still going to my pediatric one. What's your dentist's name?
Williams.
What if it's not an allergic reaction? Hereditary angioedema or systemic mastocytosis could mimic anaphylaxis.
You're not sure of his name? You just saw him this morning.
The assistant's name is Angie. Her home number is...
Normal complement studies, no skin lesions.
You had a manicure. This is fresh. You weren't at the dentist. Why would you lie about that?
To avoid having this conversation.
Elevated BP. What about pheochromocytoma?
Or an anaphylactoid reaction which could be triggered by certain opioids.
You've had your hair cut 3 times since I've met you. You can't be embarrassed about a manicure. There's gotta be a deeper reason.
Did the house give you homework?
She's not on any meds.
Haven't you heard? Everybody lies.
And the tox screen was clean.
Feel free to jump in at any time.
We'll check catecholamines for pheo and run an expanded opioid panel. You see what the patient says about drug use when her mother's out of the room.
What kind of drugs?
What kind did you have in mind?
Iris has always been a moody girl, and now that she's a teenager, it's gotten worse. So for the past few months, I've been giving something to relax her. Diazepam. I tell her it's vitamin C. Being normal is very important to Iris. She couldn't handle the thought of being on meds.
Anti-anxiety medications would explain it. If we keep her off, she'll be moody, but healthy. Or it's something else.
Feeling any pain or cramping here? A bit. But not just there, here.
Breast tenderness. Have you been having regular periods, Iris?
Not really.
What is it?
I think we should run a pregnancy test.
Iris isn't sexually active. She doesn't even have a boyfriend.
Pregnancy would explain all of her symptoms, can even cause some unpredictable allergic reactions.
How can I be pregnant if I've never even had sex?
We just need a drop of blood.
What's the matter?
My arms. I can't feel my arms.
Everything looks good.
What's the matter?
My arms.
Still nothing?
Oh, now they're sore.
Paresthesia's gone.
Bruising be caused by physical trauma?
You think she fell out of bed repeatedly?
A blood disorder, maybe thrombocytopenia.
A vitamin K deficiency or scurvy could explain bleeding problems, and pregnancy could exacerbate it.
Boys do a home search, girls do lab tests. Pretty sure that's not sexist.
She does have a boyfriend.
Love letters. Porn.
Nasty kind. Torture, rape, animals.
Sweet kid.
He came here last night. And he told me I should leave. But I didn't want to, and he got mad.
He hit you?
Physical trauma.
Explains the negatives of the blood disorder.
We should call the police.
I won't tell them anything.
That's ridiculous. He beat you.
What is it?
It's getting hard to see. What the hell is happening to me?
There are two types of people. Those who can move on and those who can't. My father keeps up a good front, but he's just like Emery. You need to leave him alone.
So he has two types of people inside of him. MRA was normal.
Yeah, how did
I found out where your boyfriend lives. When I paid him a visit, he took off, ran in front of a car.
You're lying.
He's down in the ER right now.
Shut up, you lying sack of crap.
Iris.
How do you know I'm lying? How do you know your boyfriend's okay?
'Cause I'm right here, you dick.
When you say your boyfriend hit you, it means you actually hit yourself.
And the pregnancy doesn't take a boyfriend, just a boy. You may not be aware of half the things you've done.
How could this be happening to my own daughter without me knowing it?
Diazepam was masking it. Taking her off made it more apparent.
But I wasn't on diazepam. What is that?
That's what those vitamin pills were. Iris, I am so sorry. I thought you were moody, and I didn't want you to think you needed medication. Oh my God, I can't believe how stupid I've been.
We need you to help us with something. Different alters can have different apparent symptoms. Allergies, paresthesia, vision loss, changes in blood pressure.
Do you think I'm making this up?
Your symptoms are real, but some are physiological and others are psychological.
So there's something wrong with her, in addition to the multiple personalities?
Yes, but we won't know what until we access her alters and compare their symptoms.
Well, how do you do that?
Hypnosis. You remember being hurt?
I remember everything.
Baby. It's going to be okay.
Why didn't you ever tell me?
It was my fault Daddy died.
Oh no.
So what? I was crying and he couldn't drive. It was my fault Daddy.
Oh no. No, honey. You were just a baby. It wasn't your fault. No, shh.
It's my fault. I'm sorry, Mommy. I'm so sorry.
I'm not seeing an embryo in the fallopian tube.
I'm not seeing an embryo anyway.
Which idiot did the pregnancy test?
I did one of them, Chase did another, Tab did a third. 3 tests, 3 positives. What happened to your eye?
I grabbed Park's ass. Exoplanets.
I think he said exoplanets.
Wait for it.
We can't actually see them. We infer their existence because of the effect they have on the star they orbit.
Pregnancy test only infers an embryo's existence because of elevated HCG levels.
Which could also be caused by choriocarcinoma, which affects the placenta, mimics pregnancy, and causes elevated BP and vaginal bleeding.
Occult choriocarcinoma, which is why we didn't see it on the ultrasound.
Tell all the alters that they have cancer.